seconds. Do you need us for IT at all, or can you share your screen?
Hello, that's fine. I'll share the screen. Just bear with me,
Perfect.
please, while I...
Thank you, Claire. I'm going to start. I'm here as well for everybody. So I'm going to make a start and do the first piece, and then Claire's going to follow with the second piece. So I'm Naomi Caldwell. I am a GP in Northampton. I'm sure several of you on the call know me, and I also work as the Deputy Chief Medical Officer for Northamptonshire ICB, and have been the lead for the palliative and end-of-life care programme over the last few years. So thank you for the opportunity to come today. We have been given a bit of extra time than originally intended, so we will give you a brief update about Respect, some information about EPaCCS, and then a very brief update about bereavement services that are available across the county. The slides, I am assuming, will be sent out after the event, and they do have some useful information, links to websites, FAQs, things like that. So hopefully you'll get those after the presentation this afternoon. I'll let Claire introduce herself now, and also Katie, another colleague who's here, so if they can both introduce themselves, and then we'll make a start. Thank you. Claire.
Thank you. Good afternoon, everyone. My name's Claire Mansfield. I'm in a Macmillan funded role as Palliative and End-of-Life Care Transformational Lead within the ICB. That post continues until the end of May this year.
Hi all, I'm Katie Di Stefano, and I'm the project manager within the ICB looking after the Northamptonshire Care Record, and I'm sure I've spoken to many of you previously, but thank you for having me here this afternoon.
Thank you both, and I think we'll be doing a bit of a triple act, so Katie will try and answer questions if there are any, if there's an opportunity to ask them in the chat, and I'll make a start. So first of all, I just want to say thank you to all of you for embracing the Respect project, but also particularly for the care that you give to patients on a daily basis who are coming towards the end of their life, and particularly their support for their families. It is truly appreciated, and I know how much work, dedication and compassion goes into that, so thank you. So if we just have a quick update about digital Respect. So hopefully by now you all know that is the recommended summary plan for emergency care and treatment, and digital Respect was launched in Northamptonshire in November 2024, and we use the Northamptonshire Care Record as our platform for where that form is held. It promotes shared decision making between individuals and healthcare professionals to create a personalised recommendation in an emergency care situation. So the Respect is all about the conversation. So it's a structured conversation to understand the person's condition, values and preferences, and as a result of that, a plan is made for all to be aware of on the NCR if the individual cannot make decisions during an emergency. So Respect plans, as you all know, have replaced DNA CPR forms. So it is no longer appropriate to complete a DNA CPR form, but we do acknowledge that there will be legacy DNA CPR forms in the systems, and these will be recognised by our colleagues across the system. It's also really important to note that a person can have a Respect plan and can still be for active resuscitation. Thank you, Claire. Next slide. So a bit about the Northamptonshire Care Record. So this was launched in 2023. It digitally connects over 829,000 patient records, and it allows providers of health and care services in Northamptonshire to instantly access patient information held by other care and health organisations excuse me, for the purpose of direct care. So for those of you that have System 1, it is the blue button, and for those of you that have EMIS, it's GraphNet portal, left-hand menu. Other agencies access it in a different way, but we're obviously just here to talk about general practice today. Thank you, Claire. So currently the NCR, obviously our two acutes have access to the NCR and NHFT, but as you can see from the list, there are a number of other organisations and providers across the system who can also access the NCR, notably DHU in their capacity as the Corby Urgent Care Centre, out of hours and 111, and also now the Palliative Care Urgent Response Service. West Northants Council and North Northants Council now can access the NCR also, which is really helpful. And we do have some organisations who are awaiting final sign-off, including Rainbow's Hospice, which is hospice for children and young people, not in our area, but again, really useful that those organisations can access information about our patients. Northamptonshire Carers, so Breathing Space in particular, awaiting final governance sign-off, and then Oxford University Hospitals Trust. Again, that's in the sort of coming into the testing phase. So it is being, all of this is absolutely, you know, there's really strict governance around this, but it's really helpful for colleagues across the system to see aspects of patient information. Thank you, Claire. So key points about respect. Respect plans must be completed and stored digitally via the NCR. This is because then system partners can view the plan in real time, and this ensures that the most up-to-date version is considered. We ask that a respect plan should be coded in the local system, but the document completed in the NCR. And that's just so that we are aware of how many respect plans are there, but also it's evident, if you know, for things like CQC and things like that, that you can search on those people who have a respect plan and are able to show those plans on the NCR. The plan should always be printed to ensure that the person has a copy. They then have the ability to share that with whoever they choose to, whether that be family members or maybe other organisations coming into their home or setting who don't necessarily have access to the NCR. And it's always helpful that the patient has the most up-to-date version. Generally, we're not doing several versions of this, but if there is more than one version, that will be auditable on the NCR, but we just need to make sure that the patient has the most up-to-date copy. The plan does not need to be printed in colour. Black and white is absolutely acceptable, knowing that most of us do not have access to colour printers, so black and white forms are absolutely fine. And there's a print button at the top right hand corner of the plan, and it will print on 2 pages. Thank you, Claire. So just a bit about if somebody has not consented to information sharing, and I'm sure we all have patients where we have coded that and they have decided that they don't wish to share their information. So where patients have not consented to share information, a paper copy of a respect plan should be issued, and where possible, uploaded to a local system and the GP made aware. The patient should be encouraged to share with healthcare professionals that they have contact with in the fact that they have a respect plan, but some people genuinely do not wish their record to be shared, and that is absolutely fine, and in that situation paper stands. Some people, however, may be unaware that they've dissented to share their information, or they may have changed their mind. And in these cases, if the person then wishes to change their consent to sharing, then the request has to be made to the GP surgery. So we are the only ones who can upload and agree that change. Once that is amended, then the change is made overnight through NCR, and then all that information will be available on the NCR the following day. So just a few hints and tips. Ideally, if you can use the person's own words where appropriate, that's really helpful. You can now copy and paste from your local system one or EMIS notes directly into the respect plan on NCR, which is helpful. I believe there is a word count or an amount of space that you can use, so you may not be able to put everything that you've put in the record onto that respect plan, but hopefully that makes life a bit easier for clinicians, so you're not having to rewrite things. The plan will be considered in both acute and community settings, so I guess writing it from the perspective of, if this patient, you know, we're in a different setting, how would that be interpreted? And also we are mindful that we have these conversations with our colleagues across the system in the acute trust and NHFT too. So again, we're all looking at it from a patient perspective, maybe not an organisational perspective. If need be, use just clear listed bullet points because they're helpful and clear to people in an urgent situation. As we know, the plan must be completed by an authorised clinician, so that may be someone with delegated authority, but it is an authorised clinician. Sometimes a good question is to say, what would I like to know in an emergency situation at 3 o'clock in the morning? What would be helpful to someone else to read in that plan? And the plan can be updated and completing following one or more conversations. So it may be that the person who knows that patient best may start a conversation, for example, in a care home, and that conversation can be continued as part of a ward round and then a plan completed at that point. So it's always useful to get other people to start to have those conversations. But like I say, the plan must be completed by an authorised clinician ultimately. Thank you, Claire. So this is just a bit of a graph to show the number of plans created from November 2024 when we started and where we are now in January 2026, so over each month, and we can see that there's a definite increase in trend, which is really, really good to see. And I think the next slide, yeah, gives us a bit more information. So as of this week, and I think we ran the numbers this week, there are nearly 6,000 plans live in the system, and in total 9,729 respect plans have been created in the NCR since November 2024. As we know, it's a live digital document. It stops people having to have repeated conversations, and that information is accessible to all partners. Plans are legible, and as I said, the person holds a printed copy. We do run a Respect Champions Forum quarterly, where the focus is around shared learning, quality and audit. We talk about all sorts of things there, but I think sometimes we very much focus on what we need to do better and where things maybe haven't gone as planned. If you have any examples where this has worked well for your patients, we would value knowing about those. So please feel free to let Claire or I know. Please know PID or patient identifiable data, but just some examples about where this has helped would be useful to be able to report back. But also, you know, if there are challenges or difficulties or questions, then we are always very happy to help and support where needed. So future plans include the NCR being available to broader stakeholders and the implementation of EPaCCS, or an electronic palliative care coordination system. So that leads us perfectly into our next piece about EPaCCS, and I will hand over to Claire at this point. Thank you.
Thank you, Fab, and thanks, Katie, for covering some of those questions in the chat. We'll have a check on those as we go through as well. So I just wanted to talk today about the electronic palliative care coordination system, so EPaCCS. EPaCCS is a really long-term system aspiration, so many of us have been in the system for many years. It's something that we've really needed. It is a national requirement and we're not compliant with that at the moment. EPaCCS will sit on the Northamptonshire Care Record alongside a digital respect plan. Significant benefits of EPaCCS, I won't run through them all now, but absolutely for our patients and those families, about their care wishes being able to be recorded and respected on that kind of live accessible document on the NCR. For the system, because we're not duplicating, we've got information available to us at a click reducing the number of phone calls, contacts we're having to make with other services to best support somebody either at their own home or in hospital or whichever setting they're in. Really supporting that clinical decision making because we've got that up-to-date information day or night time. And that MDT working across all of those boundaries. So, you know, for example, at the moment, if I work in NGH, I can't see the System 1 entries of NHFT or primary care, but what I can see is entries on the Northamptonshire Care Record. So we did really broad consultation. There's a big questionnaire. It did come out within palliative and primary care. So thank you to any colleagues that took the time to complete that. It was really helpful. We've never had such a huge response come back. So what our colleagues felt, and we have really detailed feedback, but we've just summarised this into themes. Really important to have contact details, to know about someone's spiritual, psychological needs. A plan for pets came through really strongly. That advanced care planning, those wishes and preferences, significant information about medications, equipment that someone has in their home, how you access their home and their property as well, and that family care involvement. So who's supporting this person? Who are they? What's that situation for that person? And then we've got some good user feedback from we did a system-wide questionnaire a while ago, and from that people could volunteer to be to support us in ongoing work. So we spoke with a range of people who'd come forward, and they were keen that there were key contacts. There's a lot of having to repeat, oh, this person's looking after me, it's a Macmillan nurse, trying to remember their name and their phone number, and having to be responsible for passing on all of those key contacts to different healthcare professionals as they met them along the way. Recording what I want in my own words, and again that comes back to that respect plan and that kind of quoting verbatim people as well. One lady gave an example about her husband who had dementia, and healthcare professionals needed to be really careful about the words that they use because certain words were really distressing for him. Again, access and equipment came up, and who you could speak to about me as well. So that kind of, you know, who's involved, and what's their role and how are they supporting. Less around that repeating information, less having to retell that story constantly, and if that's been a difficult experience for someone, the fact that they're having to keep bringing that up, it is really challenging. And that 3 a.m. need to know question. So actually in the middle of the night, if someone came to see me and they could access an EPaCCS, I'd really like them to know what they needed to know about me at that time to provide the best, most appropriate care for me to support me. So this is the NCR homepage, which hopefully you'll all be used to looking at. Care planning will appear either up here on the right hand side, just depends whether you're using a laptop or a PC screen. You can see where respect plan is there, and just below that there will either be the option to create an EPaCCS form, or if there's an EPaCCS form already there, you'll be able to go in and access that EPaCCS form. If it's not here on the top right hand corner, it will be down here on the left, but it will be very clearly in the care planning section of the NCR. So just some additional information. So it's a shared platform for documented key information. There's free text boxes, so colleagues can really write appropriately what they need to write. There's, again, as with respect, that copy and paste function as well. So if you've written some detailed information in your local record, you can copy and paste that across. You don't need to retype that. That can go straight in. There's very few mandatory fields. One of the mandatory fields that we do have is around preferred place of care and death, because as a system, we're not recording that very well at the moment, or we might be recording it, but then not recording if that's achieved and the reason why not. We do appreciate that the first time you meet someone, if you're going to complete an EPaCCS, then it may not be appropriate to have that conversation. So there are options to say that this wasn't appropriate today, or the person refused, or actually if they're very open to that conversation, you can document in there where their preferred place of care and death would be. And there's the option to put more than one place, because we do appreciate that people could say, well, actually, if this was happening, I'd like to go here, or if this was okay, I'd prefer to stay at home, for example. So it's real-time updates. It's a live document. So, you know, if Naomi saw a patient at 3 o'clock in the afternoon and updated something, and actually overnight there'd been a significant change, I could see Naomi's update from 3 p.m, but put my own update in at 10 o'clock that night. If then EMAS had to attend, say, 8 o'clock the next morning, in future they would be able to pull off a PDF of that plan. And I know Katie's been detailing in the chat how that will work with the National Records Locator. That's a huge step forward for us as a system to be able to share that information out as well. Your local help desk will be your first port of call, as with any NCR digital kind of respect queries at the moment. And again, just highlighting that EMAS will have that future access. So where are we now with EPaCCS? We've done that requirements analysis, that broad user consultation with our clinicians, our users by experience across the system. We're working really closely with GraphNet, our digital provider, to create that final version of the form. What we have done is linked into all provider colleagues around governance, comms, clinical safety, education, and going forward, there will be appropriate comms coming out into the system, a guidance video for everyone about just how to find EPaCCS on the NCR, and then going in, explaining the key features and any local guidance on completion for Northamptonshire. And the guidance, the video will be supported by a guidance document as well, which will be circulated alongside an A5 patient leaflet, which will very much be an accessible leaflet. We're just having one version of the leaflet. Our LDA and Autism Champion colleagues are kindly reviewing that information for us as well, to make sure that that's appropriate across the system. For you to go live during April, May 2026, and then ongoing support to users through May 2026. So throughout May, socialising at team meetings, happy to come out, speak to practice meetings, link in for a quick Teams call, come back to PLTs, whatever is appropriate really for colleagues in the system to be aware of this once it's live. So just to add, there's a few extra things on the end. So coming soon in NCR will be a key contacts list. This is a real benefit for us in the system. So anyone can add to that key contacts list. So if you're looking after a particular patient, or you know that they're being cared for by a specific service, you can enter that information in there to allow that to be shared. And that could be health and social care professionals, it could be the domiciliary care provider, just even the care home address and telephone number, and who the named person that supports them in the care home. Those specialist services, there might be, for example, a dementia nurse, an admiral nurse. There may be someone, if the person has a learning disability, it's who's that named person that supports them, as well as next of kin, spiritual leader, and any of those voluntary charitable sector colleagues as well can be included there. It also allows identification of someone who's a carer, and any caring responsibilities that the person that's being looked after has as well. Again, there's no mandatory fields within there, so you can record a phone number and email, role, organisation, and that free text option, which is really useful to say perhaps that, you know, Mrs. Smith is a neighbour down the road at number 74, but she holds the key, she's happy to be contacted 24/7. Those kinds of pieces of information that can be really helpful to support colleagues that we wouldn't know about otherwise. I just wanted to talk as well, before we take any questions, around the 2 bereavement services in Northamptonshire. We've had really good uptake with both services. There is less uptake from kind of the Daventry area, so if we've got colleagues around there, it would be really helpful if you know, we could promote this. The Hummingbird service is a service launched in partnership with our hospice charities, so Cynthia Spencer and Cransley Hospice Charities, alongside Age UK. That was launched in June 2025, and that is a service for any adults in Northamptonshire affected by a palliative or end-of-life care diagnosis. It's for people considered to be in the last year of life, their families, carers and close friends, both before and after death. The referral details are there, and you can self-refer. You can refer by email, by telephone, and the hospice websites also have a referral form as well. The second bereavement service is Sage Bereavement Service. So this isn't limited to anyone that's had contact with palliative and end-of-life care services. This is for anyone in the county. It is an adult service, so it is for over 18s, and they support with individual bereavement support, counselling, support groups, and again, referral. All the referral details are there. So if we could ask you to share with your networks, we'd be really grateful for that. The slides are going out to you. There's just some resources that we've included here. That's the NCR user guide there for any colleagues who need a refresher or are not so familiar with NCR, and then some respect resources as well. Thank you. Stop sharing.
Thank you, ladies. That's wonderful. I think there are some more questions. I think Katie's been answering quite a lot of them, but I think there's still some there. Craig, could we unmute Katie? I don't know. Let me see if I can do it for you. Not sure why you're muted.
Not from this end.
Oh.
You should be able to take yourself off mute, Katie.
There we go. Yes, can you hear me?
Yeah.
That's fine, thank you. I just thought what I'd do is just quickly cover off two kind of probably main themes that I've been picking up in the chat. Claire, there's a few in there about process, which I think probably a bit more sort of clinically and you know, that side of things. But just picking up on two things, National Record Locator. So just to confirm, because I know it is another acronym and another system. So the NCR is accessible by the acutes, by primary care, whether you're System 1 or EMIS, as that slide said, NHFT, out of hours, 111, they can all access NCR. So in the main, services that provide care across the county can access the NCR. Where the NRL is going to kick in and benefit us is more the cross-border information. So for example, because we are pretty much an island here in Northamptonshire, aren't we? We've got so many borders going on, that if a patient from Kettering, but they were perhaps from Leicestershire, if they have a respect plan in the NCR, but either EMAS or a different system wanted to view their respect plan, we are working to push, in effect, our respect plans to the National Record Locator. We're doing that technical work at the minute and getting all the IG arranged and what have you. So a different system, or the ambulance service, for example, they would look up an identifier, so like the NHS number, that would then say, okay, this individual has a piece of information located in Northamptonshire. That is a respect plan. Do you want to look at it? The ambulance service literally then clicks a button and they see a PDF. They don't see the patient's record, but they would see the PDF of the plan. So again, there was a comment in there about Oxfordshire, for example, same thing. If that ambulance service is connected to the NRL, when we are in a position to have our plans on there, which should only be within the next couple of months, they will be able to, through looking up an identifier, be able to see that plan. So it's again just meaning that we're just sort of spreading that little bit further, and that the information is available sort of more on a cross-border basis. But within the county, the main sort of healthcare providers do have access to NCR. You would go into it in primary care, it's through a single sign-on and you're straight in. So that's the NRL. Appreciate, you know, again, it's a complex system because we are now branching out of localized sharing. And then the other thing about codes and consent. So I think, Craig, Mel, if I could, can I email you basically how to make sure that a patient record has got the relevant codes or the consent? Because what we have found, as the slide mentioned, is that some practices or in organisations, patient records are already opted out and the patients aren't actually aware, probably because they thought of it for as being something else. But as soon as that happens and they have that GDPR objection coded on their record, you can't share their data for direct care purposes. So if I could email you the two sort of how to do it in EMIS and how to make sure it's done in System 1, if there's no codes, they should automatically come through. But if a suppression has been added, you'll need to remove that suppression, but that must be done in agreement with the patient. Obviously, we're not telling you to go and take suppression off of patient records because, you know, majority of the time it's there for a good reason. But if we did need to, in effect, reshare a record, then I can send over the information on how to do it. So they were the two main things that I picked up.
Great, thank you, Katie. Yeah, if you send that across, and I know Claire, you normally send the slides post presentation, so we'll send it all out as a bit of a pack to everybody. I don't know if any more questions have come in whilst you've been talking. No, I think you've answered them, haven't you, Claire? Yeah, I think that's it, and I think everybody's got everybody's details as well, but we can put that in the email out to everyone as well. Thank you so much for coming, and thank you, Katie and